Hello, everyone. Welcome to week 3 of the UAA conference. My name is Stephanie Begay. I'm a member of the UAA board and am the representative from the University of Utah. I will be monitoring the chat or the Q&A for today's session, and I also have the pleasure of introducing our lovely presenters for today. Before I turn the time over to them, I wanted to quickly share that the links for next week's sessions, week 4, will be sent out early next week, so keep an eye out for that email. And then just as a reminder, next week's sessions will be held on Wednesday, the 26th. So it's the only week where we're breaking from our Thursday trend. So with that, I'd like to introduce our presenters. We have Amy Soto, Kara Wiley, and Ashley Mendoza from BYU with us today, and they will be talking about overcoming empathy fatigue. So Amy, Kara, Ashley, the time is now yours.
Thanks so much, Stephanie. We appreciate the introduction. Just as you said, that's our title. We're excited to be with you today. And just so that you know who we are a little bit more, I'd like to introduce my co-presenters today. So we're all from BYU. And I'll tell you, okay, a little bit more where we work. So Kara is the Advisement Center Supervisor in the College of Nursing. Ashley is an advisor in the Pre-Professional Advisement Center. And I am Associate Director for Career Exploration in the University Advisement Center. And we're excited to chat with you today. Before we get started and as we go through our presentation, I encourage you to have a piece of paper handy with a pen or a pencil, or if it's helpful for you to have a document open, there will be a few spots throughout our presentation today where we'll invite you to take notes or to jot down your ideas or to come up with some responses on your own. Also in the Q&A or the chat, however you can see it, Kara has shared a link to a box folder with a link to our PowerPoint and a handout and our notes for today. So you can either follow along on that afterwards or use it as reference materials for later. Lastly, before I get started, I'd like to review our learning outcomes with you. So by attending today, you will be able to learn about and define what empathy fatigue is, be able to distinguish the differences between empathetic and compassionate responses, and then leave with a strategy handout and a goal to use one of the strategies that we're going to talk about today to combat empathy fatigue. So let's get started. I'll turn the time over to Kara.
Thank you, Amy. Okay, so really how we got on this whole subject to begin with was a question that was asked, similar to the question I have on the screen right now. Have you ever left an advisement interaction feeling weighed down and distressed? I know I have. And this question asked a little bit differently. I work for the College of Nursing. And so we were in a faculty meeting, and one of the faculty members was presenting on a conference that she had attended and what she had learned from the conference. And this question was asked in terms of nursing, though. Have you ever left a nursing interaction feeling weighed down and distressed? Because the keynote in that particular conference was talking about empathy fatigue. And I thought that was so interesting. It struck me. And at first, I'm going to just give you a little disclaimer. When I first heard about it, I was like, what? I mean, because the keynote was talking about using different responses and empathetic responses. And like many of you, we've been trained as advisors to use empathetic responses. So it took me kind of a second to get my head wrapped around it. So I decided to research the topic some more, and I brought in Amy and Ashley on this. And we found this article from Mark Stebnicki on empathy fatigue. And he starts out his article with this quote. In traditional Native American teaching, it is said that each time you heal someone, you give away a piece of yourself until at some point you will require healing. And I really resonated with that quote because I feel like that happens a lot in academic advising. So let's talk about what is empathy fatigue? And we'll talk more about what that is. So real quick, you can go ahead and write this in the Q&A. You can write it on your piece of paper for just yourself, but type into the Q&A or write it down what you feel is empathy. What does empathy mean to you? I love the picture we have up on here right now as the difference between sympathy when everything is going to be all right and empathy where everything is going to be all right. And for years and years and years, this is what I have been taught as an advisor to express is empathy. So let's go to the definitions that I have. And if you have one you want to put in the Q&A, please, by all means, do so. So definitions of empathy and empathy fatigue. Ashley, if you could advance, there you go. So what is empathy? I've just pulled out the Webster, the Merriam-Webster dictionary here. The action of understanding, being aware of, being sensitive, and here's the key, vicariously experiencing the feelings, thoughts, and experience of another, of either the past or present. So you're feeling with the other person, you're feeling what they're feeling, right? So empathy fatigue then is when we take on the emotions of the student to the effect of feeling that same feeling, the tiredness, the depression, the overwhelm feeling we get, the stressed out feeling we get, the burnout. Thank you, Melissa, for putting a Q&A in. She defines empathy as when you feel what the student is going through and can understand and relate to it. Exactly, when you feel it. So if you're feeling the same stressed out feeling as somebody else, it can lead to burnout and being overwhelmed, just like it does for the student. So that's what empathy fatigue is. So let's watch a quick little video. This was the keynote speaker at the conference that my faculty member attended. His name is Dr. Zubin Damania. He goes by ZDog MD online. He has a podcast as well as a YouTube channel, and of course he does do regular, he's a doctor as well. And he's going to talk to us. Now granted, his opinion is a little bit stronger than what I want to convey today, but he's going to talk to us about empathy and what would be better in place of empathy. So go ahead and roll that video. Oh, can't hear it, Ashley. Sorry, we're going to go ahead and reshare it so we make sure that the sound is correct. There's another chat or Q&A that says that empathy is understanding and sharing the feelings of another person. I like that definition as well. That's awesome. Thank you for putting those into the chat. And I will just say, Dr. Zubin Damania, I just want to point out something real quick on his video. At the end, he's going to be talking more about what is the key or what can replace perhaps an empathetic response. And I want you to listen to why he thinks that is the best idea. And again, this is his idea. So we can go ahead and roll that, Ashley, whenever you are ready. Like doesn't want to. There we go, pops up. Okay.
What is empathy? It is feeling somebody else's pain as if it were your own. Now, how does that work? If I feel a patient's pain as it were my own, I will act on behalf of that patient to relieve the pain. Now, that act may not be the right decision for that patient. It may not be the act that actually improves their life in the long run. So empathy has this spotlight on feelings, and you take it on as a burden to yourself. The second problem with that as a healthcare provider is, well, you're going to burn out feeling everyone's pain. The idea is not to take the pain as your own. The idea is to understand what the patient is feeling and act out of love. And that's a different thing. Now, the third problem with empathy is it is very hard to empathize with more than one thing at once. So you can empathize with a little baby, but you cannot empathize with a population of people. You can't empathize with a people. And this leads to really bad, short-sighted decisions. Empathy is a spotlight, and it can fool us into doing the wrong things. It can lead us to emotional fatigue and exhaustion, and it can lead us down the path to moral injury and its end stage, which is burnout. So what do we do if we can't use empathy? It's really pretty simple. It's compassion. What is compassion? Compassion is love in the face of suffering. You recognize somebody's suffering, you understand it, you don't take the suffering as your own, but you care about that person, you care about relieving the suffering, which means you're playing the long game. It means you're doing the right thing for the best interest of that patient and that person to relieve their suffering. And that may mean tough love in the short run. It may mean that love in the face of suffering is something that you can cultivate, you can grow, it's inexhaustible, you never burn out From compassion, there are monks in caves who practice this 24/7, and they are crushing it. So the bottom line call to action is, let's stop talking about empathy and let's start talking about compassion. Love in the face of suffering. There is no such thing as compassion fatigue. It's empathy fatigue. So let's get our terminology right so we can get our minds right, so we can get our hearts right, so we can take care of our patients while taking care of ourselves. All right?
So some things that I really liked about this, well, first of all, obviously he was talking in terms of healthcare, but you can easily make the connection over to academic advising. But I really liked that he talked about how empathy can lead to a spotlight. And I'm not saying that empathy, he says empathy is wrong. I really think that there are probably appropriate moments to have empathetic responses versus a compassionate response. But if we use empathy too much, we burn out really quickly. So what he suggests is that we use compassion, and sometimes that's called tough compassion, right? Tough love, tough compassion. It's the terminology of tough compassion is actually gaining traction right now. But if we can go to the next slide, let's talk about compassion a little bit. Compassion, according to ZDogg MD or Dr. Zubin Damania, is love in the face of suffering. So we took that a little further and actually researched more, okay, about compassion. Paul Bloom in 2016 wrote a book entitled Against Empathy. So it's an argument against empathy. And he writes, in contrast to empathy, compassion does not mean sharing the suffering of the other. Rather, it is characterized by feelings of warmth, concern, and care for the other, as well as a strong motivation to improve the other's well-being. Compassion is feeling for, not feeling with the other. And I really love that. It's feeling for the person. It's characterized by care and concern for the other. Isn't that what we are to do as academic advisors? So let's go to the next slide. There is a lady named Dr. Susan David. She's the author of Emotional Agility, Get Unstuck, Embrace Change, and Thrive in Work and Life. And I love this image she has up here. She talks about sympathetic responses, empathetic responses, and compassionate responses. Sympathetic, her example here is, I'm sorry you're in pain. It's a very distant kind of stay away kind of response. An empathetic response is shared, right? I can imagine what this pain feels like. A compassionate response drives connection and also has the element of being action oriented. So you are suffering and I will do what I can to help. There's always something that motivates to an action, right? So that's a compassionate response. And we're going to go ahead and watch a little video on how one thing we can do to help increase compassion. Brene Brown, as a lot of you know who she is, she's actually one of my favorites. She states, she did a 60-minute interview, and she states that empathy is a skill set. It can be taught, it can be learned, it's a collection of skill sets, whereas she describes compassion as a belief system. It requires commitment to how we treat ourselves as well as how we treat other people. In her research, she looked for the common theme amongst the most compassionate people. And she found something very interesting, and that's what I want us to watch for, listen for, and see why. So go ahead and play that video, Ashley.
Us, of course, but so I was like, what do they have in common? I assumed that what compassionate people shared in common was faith or spirituality.
And?
You know what they share in common?
What is it?
Boundaries.
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 What do you mean by boundaries?
That's what I asked. Compassionate people have very clear boundaries that they insist are respected. They respect other people's boundaries, but they also have their own boundaries, and they're very clear about what's okay and what's not okay, and they enforce that with the people in their lives.
So it's not just blanket compassion.
It is blanket compassion.
It is.
Predicated by boundaries.
So I love that. Blanking compassion, but predicated by boundaries. So if we want to do better in having compassionate responses to our students, we need to learn how to set boundaries. And Amy is going to talk to us more about boundaries as one way to overcome empathy fatigue, because we're going more toward the compassion side. And then she'll review some other methods as well. So let's turn the time to Amy.
Great. Thanks so much, Kara. So when it comes to advising, in our role as a helper, it's easy to try to help students in any way that we can. However, in what ways do we practice compassion for ourselves and others in our daily work through the use of boundaries? Let's talk about what boundaries can look like. Over the last 2 weeks, as I've been attending this UAA conference, I've noticed many people have shared best practices and ideas of how to be, a great advisor. I've heard phrases like clear is kind, or making referrals is really helpful for students. To me, those are really great examples of how to implement clear boundaries. And that helps us practice compassion with our students. As we were looking at, our different ways that we work with students, we thought of some ideas of how boundaries show up for us in our work, right? Here's some examples on the screen. We communicate expectations clearly and early. And maybe that's saying, I only have 30 minutes today, or maybe it's saying, I'm only available during these hours, and this is how you schedule with me. Many advisors have that down, right? Also in an appointment, sharing your role expectations, what I will and will not cover in the appointment, like that's beyond what I do. Let's make an appropriate referral. I can also see boundaries play out in our personal, professional goals. And sometimes there are some limitations, right? We may need to creatively work within the limitations that we have in our advising role, whether it's time or resources and possibly even space. And you know your limitations, right? But also, I think where we're seeing this most often is in how we're communicating with students. So we wanted to give you an example of how this might be playing out for you in your conversations. So, and we are also setting this up in a way to, I guess we want to say that we use empathy, and we think empathy is a great tool. We're hoping that compassion can also be a really great tool for you that you have on the ready. We know that many times we are, transitioning between sympathetic phrases, empathetic phrases, and compassionate phrases. And the unique thing about compassionate phrases, though, is that it moves us to action. So I'm going to share some examples with you, some things that students commonly say, and we'll go through and review some of that. On our next slide, I'll give you the chance to try to come up with some compassionate phrases. So let's go back a slide, Ashley. So let's review this together. Student could say to you, COVID-19 has taken a toll on my mental health, and as a result, I have not done well academically this semester. Sympathy, if you're using sympathy, right? I'm sorry the semester is hard. Empathy, I felt with you how challenging this pandemic has been. Now listen to this compassionate response. You've been through the ringer. Let's talk about what you can do to help you feel more comfortable or more capable of making it through this semester. There's the acknowledgement of the feeling in this movement forward. And maybe if this were real life, we'd probably say a few empathetic phrases first and then end on compassion to pivot to action. So next phrase a student might say to you, I come from a long line of, name that career, doctor, lawyer, whatever, teacher, and my family expects me to carry on the legacy, but I'm not sure I want to follow that path. With sympathetic response, you might say, that sounds stressful and a really tough decision. Empathy, you might say, I understand the pressure that family can put on each of us. Compassion might sound like, it sounds very overwhelming to carry the weight of the opinion of others. Let's explore what other values and interests you have that are equally important to you. Okay, last example here. A student says, and I'm sure many of us hear this often, I didn't get into the program of my dreams. I don't know what to do. Sympathy, I'm so sorry you're disappointed. Empathy, I know when we work so hard for a goal and don't achieve it, it's devastating. And then compassion, I'm sorry for this devastating curveball. I'm sure that's not what you expected. I wonder if we take some time to look and discover options to still achieve your ultimate goal. So you can kind of see the difference in I like looking at it in a compared way, right? Because we can see where, oh, sometimes I usually say this, or I do this too. And to see the comparison, I think it's a little bit more clear. So now it's going to be your turn. Go to our next slide. I'll share 3 student examples, and I'd like for you to choose one. And I'm going to go ahead and read through them. I'm not going to read the sympathy and empathetic responses, but they're there as a reference or as a starting point. And I'd like for you, after I review these, to go ahead and choose one and go ahead and comment the number of response you're going to choose, student 1, student 2, student 3, and then tell us the compassionate response you would say in response to that student. And then I'll give you about 30 seconds to come up with your own response and give it a try. I think it would be really helpful to hear what you have to say. After we have a few responses come through, I'll go ahead and share some that we came up with. So, student number 1, everywhere I go, no one seems to be able to help me. You are the only one I trust. How many times do you hear that? It both makes you feel like you're doing a good job and also feels like they may never leave you. Number 2, I am so overwhelmed with all that I need to do to explore majors. I'll never get through this. And maybe I should have, let me start with this one. So I'm so overwhelmed with all that I need to do to explore majors. I'll never get through this. With sympathetic response, you're right. It is a lot to do. Empathy, I want to help you through this. You're not alone. And student number 3, I'm failing all of my classes this semester. Maybe I should just give up. Sympathy, you sound very overwhelmed. Empathy, it can feel so scary to feel like you will need to fail out this semester. So go ahead, I'll set a timer for 30 seconds, and we'd love to hear your feedback. All right. So let's look at some responses, and thank you for numbering them. So number 3, so I'm failing all of my classes. I'm sorry you're struggling. Let's talk about what has gotten in your way this semester and then explore some bounce back options. I love that. Number 2, about I feel overwhelmed about making a choice. I'll never get through this. Many students can get overwhelmed figuring out a major. You're not alone. Let's talk about how to break it down into smaller steps so it isn't quite so much all at once. I love that response. As you're still writing and thinking, and we'd love to see your answers come through in the chat, let's share our responses. So for number 1, you're the only one I trust. Maybe you could say, you have been trying so hard to find answers. I'm not sure I know everything to help you, but we can look into this together, right, to get started. Number 2, I'm so overwhelmed with the options. I'll never get through this. You could say, wow, this process may take some time. Let's outline your next step to get you started. And then number 3, I'm failing out of all my classes. I feel like I need to give up. An example here could be, sounds like you feel defeated. Would you be all right if we talk through what is happening this semester? Okay, we have some other examples coming through. We love this. I love to see this. What's helpful for me sometimes, especially in the Q&A, I'll sometimes copy the responses, copy that onto my document and refer to it later. I love seeing these responses from everyone else just because I like to see how other people think through similar situations. So I love this feedback. This is beautiful. Everyone, thank you. So we're going to keep moving forward, and we'd love to see all the answers coming through the chat because we'll go through and copy those as well. Let's see. Okay, thank you, Ashley. So now that we've experimented how to use some compassionate responses with students, we have the opportunity to consider how to practice compassion towards ourselves. In the long run, This will allow us to have more compassion in our work with our students. And I'm sure you heard of the example of the time management and about setting priorities. In this example, you're given a jar with a certain amount of rocks, pebbles, and sand, and it can all fit in the jar if it's put in the right order. It's suggested that you put the big rocks first, then the small pebbles, and then the sand. If you do it any other way, it doesn't work and you're left with protruding rocks. Similarly, as we put first things first, we can prioritize ourselves as an important part of our advising practice. Rather than saying, I don't have time for this, we can say, I have time for the most important things. There is always time to take care of myself. So the strategies that Ashley and I will share today are meant to be preventative. We suggest doing these things so that you do not find yourself completely depleted with nothing left to give. When something is broken, we're usually quick to fix it. And similarly, self-care is not selfish. Only we can care for ourselves in ways that will make sense for us. Here are some strategies that we would love for you to consider. So we're going to talk about managing stress, self-compassion, and mindfulness. So part of, being compassionate has to start with our ability to manage our own stress. This is a personal boundary that we can implement in our own lives anytime by being intentional. In the book titled Burnout, The Secret to Unlocking the Stress Cycle, Emily and Amelia Nagoski describe the physical toll that stress can take on our bodies and how to manage it effectively. They describe stress as more than a feeling. Their research on stress has found that stress goes through a cycle for completion in order for it to be released. The key piece here is doing something physiologically to complete the stress cycle. Why would this matter? The impact of stress on the body can lead to some major physical decline. On the surface, it can lead us to feeling anxious, fearful, and maybe even impact our behavior or mood. In the long run, if it goes untreated, it can lead us to chronic illness, hospitalization, and even poor body organ function. And as they said in their book, it can even kill you. Taking the time to care for ourselves by addressing our personal stress might just be the most compassionate effort that we participate in daily. So, how do we help our body to physiologically complete a stress cycle? Let me share 7 examples that the Nagoski sisters share in their book. So, I'm sure you've heard of these before and perhaps you do them often, but we invite you to consider what will work for you. One of the most effective ways is to move our body. If you're not a formal exerciser, just know that any movement counts. Next, deep belly breathing is something easy to do while you're sitting at your desk, even in between appointments. You can do this guided by yourself or with the aid of a mindfulness recording. Next, in the privacy of your office, or even when you return home, it's okay to cry if that's a comfortable way for you to express your emotions. And if that works for you, consider it like letting the river run its course and crying till you're dry. The next part is more about connection. So laughter. Laughter is a great way to deal with stress. You may want to have some go-to videos on YouTube that you watch to make yourself laugh. You can read some jokes and you may even look at some hilarious advisor memes. Now, the next one is interesting when it comes to affection, especially within a work environment. A suggestion that they gave is sometimes this might even happen with yourself. So you can hug yourself, right, in a stressful moment. You can put your hand over your heart. You can squeeze your arm, hold your hands, or even cup your face. Add a few compassionate phrases, and that can usually comfort you in a time of need. Positive social interaction. For most part, advisors are, when we're in an office, we're passing each other. We get that all the time. But it's interesting that they said, even if you're not around people that you're close to, commenting or reaching out in kind ways to others can help you in that way by saying, I hope you have a great day, or wow, your shoes look really great, or thank you so much for doing that service with a smile. It's brightened my day. Small interactions like that can help you as well. And lastly, something I thought was really interesting is that they supported creative expression. They said not to underestimate the possibility to process your feelings through art, music, dance, and storytelling, and so on. It's one of our greatest forms of self-care. So they also said doing something, anything, will make a difference. Our overall wellness allows us to serve students from a place of generosity and balance. It can move us to a place with more personal energy, substance, and renewal. Again, we respect students better as we respect ourselves, and managing our stress is one way to recapture a piece of ourselves. So now I'll turn the time over to Ashley to continue this conversation about self self-compassion and mindfulness.
Fantastic. Thank you so much, Amy. As we're considering this last year, we've experienced a lot of opportunities and challenges in advising. And as I was thinking about different strategies that we can use, self-compassion came to mind. Professionally, we experienced a lot of change, and we saw our students go through trying times. As Kara quoted earlier from the article by Stebnicki, each time we heal someone, we give away a part of ourselves until at some point we need to heal ourselves as well. So many of us went into this profession because we like to help people. I know I myself really enjoy working with students and the colleagues and other advisors we have, and it makes the job really exciting. However, in order to best help others, we need to start with helping ourselves. And as a result, self-compassion is a strategy that we can use to combat empathy fatigue. Dr. Kristen Neff is where I get a lot of this information from on self-compassion, and she's dedicated her life work toward self-compassion. So I wanted to read a quote here that she says regarding the topic, and it's self-compassion involves acting the same way towards yourself when you are having a difficult time, fail, or notice something you don't like about yourself. Instead of just ignoring your pain with a stiff upper lip mentality, you stop to tell yourself, this is really difficult right now. How can I comfort and care for myself in this moment? And I think it's really important to emphasize this last part of the quote. How can I comfort and care for myself in this moment? Because as Kara talked about, compassion is connectedness and action oriented. So it's not just noticing what we're feeling, but it's paired with an action. And as a result, there are three components of self-compassion that I'd like to talk about in which Dr. Neff teaches. And I'm going to use a personal example in advising in hopes that I can better illustrate each component. So, as I mentioned, this last year has definitely been interesting as our jobs have looked a little bit different as we've transitioned to doing virtual advising. And something that has been really challenging for me is screen fatigue. Like I mentioned previously, have loved this job because of my interactions with students. And I remember being in the office and after each appointment, just really feeling rejuvenated and really excited. And yet I noticed, within a couple of weeks, a couple of months of doing Zoom appointments, that instead of feeling rejuvenated and excited after every appointment, I was feeling more fatigued. And so this first component is self-kindness versus self-judgment. We are our biggest critic, and it is very easy for us to be judgmental and self-critical, and yet sometimes really easy to be really compassionate and loving toward others. And so in this example, instead of saying this thing shouldn't be this difficult, why can't I just power through, Dr. Neff proposes that we say something like, I'm having a really hard time right now. And I got to a point in the summer last year where I had that shift. I recognized that instead of just feeling like I was to power through, like Brene Brown has said in some of her work, this is our first time doing something like this. And so having that self-compassion to say, I'm having a really hard time right now, goes to the component of self-kindness. The next component is common humanity versus isolation. And I think that this word isolation is interesting again in thinking about this last year. I know for me at the beginning, it felt really isolating to feel alone in my struggles with screen fatigue. And I kind of, like I mentioned, just tried to have a stiff upper lip mentality and push through. But it wasn't until I started talking to my team and my colleagues and my director, I realized, in those conversations that others were experiencing the same thing. And in turn, it helped me feel less alone. And so that connects really well to this component. Rather than feeling isolated or alone in the stress and uncertainty of the events of our lives, professionally, personally, recognizing that these emotions actually are universal. And so as I realized that my other teammates were feeling similarly, it was really helpful for me to feel less alone and more connected to my teammates, but also, the advising humanity. The third point is mindfulness versus over-identification. So I'll talk a little bit more about mindfulness later, but mindfulness allows one not to be over-identified with your thoughts and feelings and overwhelmed by your negative reactions. It can help you label and observe your emotions without reacting to them. So again, thinking about this example, mindfulness helped me be in that present moment. I would check in with myself after an appointment and see, how am I doing? I wasn't focusing on maybe being tired from previous appointments. I was focused on that appointment, checking in. And I'm also not focusing on the past or the future. When we're lost in our thoughts and emotions, we're normally in the past or the future. However, reality only happens in the present moment. And so practicing self-compassion means that I can acknowledge the feelings that I'm experiencing and move on rather than over-identifying with them. So not staying in that emotion, especially if it's negative, but feeling it, and also being able to move on rather than over-identifying. So we can't heal what we can't feel, and that's why this idea of mindfulness is so important. So what are some self-compassion strategies that we can utilize? Dr. Neff has a lot of self-compassion strategies, and I'll talk about this a little bit later, but we do have a box folder full of these resources, including a link on her strategies. So I just wanted to mention a couple. This first is, how would you treat a friend? This question is rhetorical, but I'd love for you just to consider it and think about it in terms of your both professional and personal lives. How do you think things might change if you responded to yourself in the same way you typically respond to a close friend when he or she is suffering? It's a fascinating question and fascinating thought. The second is identifying what we really want. So Dr. Neff often talks about, this ability and the importance of knowing what we're feeling and being in tune with that, but then also that action piece, right? So she says, every time you catch yourself being judgmental about your unwanted trait in the future, first notice the pain of your self-judgment and give yourself compassion. Then try to reframe your inner critic or inner dialogue so that it is more encouraging and supportive. So I love, paired with noticing how you're feeling and giving that self-compassion and taking some action. The third one is a self-compassion journal. I personally am not very good at writing or keeping a journal, but my thought is many of you may be. And so Dr. Neff says that keeping a daily journal to write about the difficult events of your day through a lens of self-compassion can actually help with your mental and physical well-being. And I think that's a beautiful thing. So how does self-compassion deal with this combating empathy fatigue? Well, we personally believe that as you're able to use more self-compassionate strategies, and as you tune into what you need and giving action to how you can better care for yourself, you in turn can then better help those around you. So the next strategy is mindfulness. And I love this image here in front of us. So on the left-hand side, the left-hand bubble, you can see that this individual has a mind full, and that is very normal. We often have many hats that we wear, plates that we're juggling, things happening in our lives, and we're consistently thinking about those things on a day-to-day basis. It's interesting to see the juxtaposition of the thought bubble on the right-hand side. You can see that that person is seeing the sun, the trees, and the ground, which is exactly what that individual is seeing in front of them. So do we have a mind full, or are we practicing mindfulness? So what is mindfulness? Mindfulness is the basic human ability to be fully present, aware of where we are and what we're doing, and not overly reactive or overwhelmed by what's going on around us. And I think in terms of advising, it can be really tough and challenging, like I mentioned, with all the hats that we wear, and we're thinking about a lot of things at once. However, here are some tips on how we can practice mindfulness and be more mindful. The first is paying attention. So you can see, in this image, this individual is just paying attention to what's going on around them. And as a result, staying in the present moment. So focusing on exactly what is going on right there. However, I think the last 2 points are in some ways most interesting to me, and it's responding, not reacting, and having a non-judgmental perspective. And so what that means is mindfulness enables us to see thoughts as thoughts, not facts. So it's noticing, almost, being able to take a perspective and step out a little bit and just notice what we're experiencing and feeling. Mindfulness teaches us to be aware instead of judging. And I think that's a really tough but a really important tool as we're practicing mindfulness. So we're going to talk about different types of mindfulness and strategies that we can use. So Amy talked about some of these when she was discussing breaking the stress cycle. However, mindful breathing, I think, is one of those tools that you can take wherever you are. You can do it in between appointments, you can do it before your workday or after your workday, and there's formal and informal ways to practice mindful breathing. There's guided meditations and breathing exercises, but also before an appointment for 60 seconds, you can breathe in 5 seconds, breathe out for 5 seconds, and do that repeatedly. The second one that I wanted to talk about was mindful eating. So I'm curious, as you're thinking about this, how many of you are guilty? I know I am, about not really taking good lunch breaks. You may eat your lunch, but you're also answering emails or doing other projects or any other things that you can think of, maybe throwing in a load of laundry now that we have been working from home. But when is the last time that you actually tasted and focused on what the taste of your lunch was or the taste of your dinner was? And I'm talking about the flavor, the texture, really noticing what that experience is like. This is mindfulness. And I remember as I was learning about mindfulness, the different types were really surprising to me. So if you haven't eaten your lunch today, I'd love to give you a challenge. Really tune in for 30 seconds and notice what your lunch tastes like. And maybe it's the 4th day of leftovers and you're not as interested, so maybe save it for dinner. But it's a great opportunity to stay mindful. The third is mindful walking. My colleague Kara is really good at doing this and implementing this. She's done that during the pandemic. You can take a short walk or a long walk, but I would challenge you as you're doing that, tune into your 5 senses. What do you notice? Body scans are great. One thing I like about that is muscle relaxations. An easy way to do that is to clench your fist and unclench your fist and notice kind of that physiological response. Yoga is probably the most common and most popular way of mindfulness when we think of it, but it's a great way to quiet the mind and tune into the body. So ultimately, you can practice mindfulness with everything. You can find ways that work for you and lean into the fact that not everything will work for you. You may be a mindful guru or this may be new to you, but I'd encourage you to maybe branch out a little bit and see what things could work for you. So ultimately, mindfulness is a great way to reset, rejuvenate, and help you so that you then can be able to show more compassion and show up for students and those around you. So how can we use this in advisement? As we've talked about earlier, we've been taught to go straight to empathy. And we are not suggesting that you should not use empathy. In fact, empathy is very appropriate in many settings, both professionally and personally. However, we are suggesting that you consider how you can use more compassion, compassionate responses, and boundaries in your advising to combat empathy fatigue. We believe in doing this, you can help empower students and still help them feel heard and valued. And I think those are paired importantly together, empowering and helping them feel seen. So in addition, we encourage you to find ways that you can break your stress cycles and that you can incorporate more self-compassion and mindfulness in your quest to combat empathy fatigue. In doing so, you will have greater capacity to give to yourself and others. So we wanted to give you all a minute to write a goal to implement a tool that was taught today to overcome empathy fatigue when you return to work. Some examples of this may be, I will practice my boundaries by explaining to students the parameters of my scope of service at the start of every appointment, or I will take a walk each day at noon for 5 to 10 minutes. And I wanted to, reiterate that some of you may be excelling at many of these. However, I'm hoping there's something that you feel like you can strengthen or work on, or maybe there's something new that you'd like to try. So we'll give you until 44 to do that. Okay, know that was a quick minute and probably not enough time to be reflective perhaps on what you would like to work on today, but I hope that you have some ideas and thoughts that you can consider and ponder on that perhaps may be helpful for you in the future in your advising. So we wanted to turn the time over to you for some questions that you can put in the Q&A. As you're doing that, I wanted to just go over a couple of things briefly. There should be a link in the chat with our box folder, and our box folder has our resources. It has the page in which you can practice compassionate responses, and also our PowerPoint with our list of resources that we've used for this presentation. Questions that you may have maybe more about compassion versus empathy, the strategies that we've discussed today, or boundaries. So I'll turn the time over for you all. And I can't see the chat, so if someone can help me moderate, that'd be great.
I've been answering questions in the chat, actually. I don't know if they can hear me or not, but I have been answering as they've been coming in. We do have a couple of goals people put. One was, I will take an actual lunch away from my desk and without phones. Love that goal. I will take an actual lunch away from my desk without a phone. Great goal. Practice more compassion and less empathy. That's awesome too. I would just practice more compassionate responses. And remember, compassion, the one thing I wanted to pull out about compassion beside the boundaries is that sometimes it's a little tough to do. Not because you don't feel for the person. I mean, remember, compassion is love in the face of suffering, right? But because it sometimes requires the tough compassion, right? The tough love kind of thing, where what is best for the student long term, not just to take away their pain in the moment, right? I experienced this a lot with nursing being a limited enrollment program, and having to have hard conversations with students a lot about what is best long-term versus just helping them out in the moment to help with that one issue. Sometimes that means letting them be accountable for what has happened, right? And that can be really hard to do. So I think that I love what they wrote about practicing more compassion, because I think that is a really difficult thing long term. And I'd love for you guys, we gave you kind of an intro to this idea of using more compassion and empathy. Not that we're saying empathy is wrong, although Dr. Zubin Damania did. But like I said, he has a really strong opinion on it. But it was the idea that got us started, right? Thinking about this whole thing and using more compassion for ourselves and for our students. So I don't think there's any more comments or questions in the Q&A. So I think that we will say thank you very much for coming to our session today. If you guys have questions, feel free to contact us. The information is right here on the screen, but also, again, in that box link that we put in the Q&A, you have this information there too. So feel free to, as this was an intro to the idea, feel free to work on and develop it more deeply for yourselves. Research it yourself and find out what you like about it. Thanks for coming, everyone.
All right.